postpartum labor update. So it was not what we thought it was going to be. We don't get to use the postpartum rooms, which was a little disappointing, but they did add more for the doctors to do with the baby once the baby is born. So here we go. Olivia was so great, and she let me treat her as a pregnant mama. You'll see that we are talking back and forth throughout the video. Also, sorry, my voice is still gone. It's getting a little better, but still gone. So the beginning stays the same. We take mom to a room, we give her a gown, we do the urine sample like we do before, but I don't know if you noticed, but the warmer has a cute little blanket on it now, which is adorable because when you actually give birth, they have those cute little blankets. Okay, so we're taking the urine, we're putting it in the tube system here. I'm headed back, throwing out my gloves, washing my hands. This is when we are waiting for the lab, so it takes time. So we're just making conversation. I tell her they added a cute blanket. I ask her if she thinks it's a boy or a girl. She thinks it's a girl. I also thought it was a girl. Any guesses in the comments before we actually deliver? So she says girl, I say girl. It's nice that we can chat. Okay, lab results are in. She is pregnant. She cannot eat or drink, so we are going to go take her vitals. Temperature, heart rate, blood pressure. We ended up going into my private server because in the public server, it was glitching like crazy. Patients were disappearing. I took Olivia, and then it said I didn't have Olivia. It was a mess. Okay, next step is we are getting her ice cup and her ice chips for her to munch on. And then we will walk our 200 steps like normal. So that has not changed. Just walking around. In a public server, it's hard. I try and stay in the room because I don't want people to like steal my room, but it was good. We walked around. Okay, back in the bed. Now I'm attaching the fetal heart rate monitor and I'm checking the strip. We are attaching her IV saline and I'm turning the warmer on. The warmer puts the hat in the swaddle. Here's a new thing. At the end of the bed, there was that table. It gives you all of your tools that you're going to need for delivery. So that's new. We're giving her anti-nausea medication. And here we go. We're going to get ready for contractions and we're going to help her count. Emily comes in. She's my awesome labor and delivery nurse. She's always here to help. Shout out to Emily. So here we go. Counting. It's a boy. So here's new. You grab the bulb syringe and you suction baby. That gets them breathing. It took me a while to get it off this table. So I went to suction. Then I get the washcloth to clean. Then I get a hemostat. This clamps the umbilical cord. Then you need the scissors to actually cut the umbilical cord. I couldn't get it off the table, so I just went into my toolkit. So those are all new things, which I liked. It added. Ginger ale is new. So you go and you get the ginger ale. It also gives you a cup. So this is sort of like the pink medicine where you click the cup and the ginger ale and it pours it in there and you give it to mom. Mom's resting, but now we have to weigh baby in the warmer. Baby needs eye ointment, so you go in here. Took me a while to find it. It's actually on the other side, I believe. Yes, right there. Eye ointment. It doesn't say apply, so it was really odd. It just says take baby. I think it's a glitch that they will fix and they will say apply to baby. So they'll fix that. I have to enter baby's weight. I'm going to put oxygen on mom because it says to. And then baby needs a vitamin K shot, which is also by the ointment. So I zoomed in. We get the vaccine. Same thing happens here. It doesn't say apply, it just says take. So I ended up like taking the baby. I have to like put the baby back. So they will fix that, I think, where it says apply the shot and apply the ointment. Now we get the food tray. The food tray cart is working now. So I'm going to give it to Mom and place on her table so she can eat. I'm giving the baby to Mom. The mom is going to feed the baby and sleep. Now I'm getting her fetal heart rate monitor and I'm filing that away instead of discharge papers. Mom is sleeping. I'm taking off my gloves. Here is where we get a wheelchair. This is where I was expecting to take her to the postpartum room, but you don't. You just take her outside and she goes home. I took her back because she was still attached to the monitor, so I tried to detach her. It's still glitching. There's still glitches. That's what happens when you first do it. Okay, so I was expecting to take her to the postpartum room, but we didn't. We just take her outside, and that's it. Then it ends, and we both were like, that's it? Watch us. We text each other in the chat. We're like, this is it. We were really hoping to take her to the room next door and change the diapers and feed bottles. I hope that's coming. Maple Hospital, please make that happen. You did add some fun things for us for postpartum delivery, but we want the nursery. We want those postpartum rooms. That would really be great. So I'm looking forward to that. I hope that comes next. But yeah, that's the update. I'm going to try and go live if my voice gets better. Follow for more and ask questions, and I will see you all on the next one.